This is QD Clinic. I'm Jack Cush with RheumNow. QD Clinic is brought to you by RheumNow.live. This is where great rheumatologists go to great meetings. February 8th and 9th in Dallas. We look to see you there. Here's the case. Neck and back pain in a 43-year-old man. He presents with the acute onset of neck and low back pain over a week, and he also has a polyarthritis with swollen joints in the elbow, wrist, and knee. He's got a fever of 38.5 centigrade. And on initial evaluation, his labs look normal, but his CRP is really, really high. It's 26.5 milligrams per deciliter, or 265 milligrams per liter. Because he has a swollen joint, we're going to do joint aspiration. We're going to get imaging of his neck and his lumbar spine. The knee aspiration shows he has 73,000 white blood cells, 80% neutrophils. So given that acute presentation and the polyarthritis and the septic range on the synovial fluid count, he was thought to have a presumed infection. So he was started on general antibiotics until we were able to make a firm diagnosis. The MRI showed that he had what looked to be an effusion and inflammation of the facets between C3 and C4. And in the lumbar spine, between L3 and 4, he had a bursitis that with a collection of fluid. So, and a repeat CT of lumbar spine showed an erosion at L4. So the question is, what is this? Could this be an acute onset of spondyloarthritis? Could this be an acute onset of gout in the spine? Could it be that this is a septic, polyarticular presentation? The synovial fluid cultures came back positive for, key in your vote now. That's right, Neisseria gonorrhea. It was proven by nucleic acid amplification tests on synovial fluid and also from the oropharynx. The patient did admit to unprotected sex. He did not have any urogenital symptoms, rectal symptoms. His antibiotics were changed to ceftriaxone, and then he received that for 27 days. And this was a case of a sexually transmitted disease presenting as arthritis. Other tests for other sexually transmitted diseases, including syphilis and HIV, were negative. There was no known reason as to why this man got this. This case reminded me of a case in my residency where we had an 80-year-old woman present with septic arthritis in the shoulder, and that was due to Neisseria gonorrhea. So yes, you suspect that with acute monoarthritis in young people. It's almost the diagnosis that has to be excluded in such presentations, but it should never go off the table, and that's the lesson of this QD Clinic. Tune in for more. We'll see you at RheumNow.live.